This is an HSC podcast hosted by students and for the students, where we talk about all layers of your well-being.
The views and expressions said in this podcast episode belong solely to the guests of this episode. They do not represent one structure or population as a whole. If you are concerned for yourself, a friend, or a fellow HSC student, please reach out to the care team at 817-735-2570, and they can help you navigate your crisis.
Welcome to the brand new student-led podcast from the Be Well team. I'm your host, Dhruvi, a second-year student at the School of Public Health, and this is my co-host, Sophia Brockman.
Hi, I'm Sophia. I'm with the Office of Care and Civility. I serve as our student services specialist, so I do a lot of our compliance programming, social media management, and now I get to co-host with Dhruvi.
Welcome to another episode of Wellbeing Unlocked, where we discuss navigating life as a student and all things well-being. Today we have two esteemed guests joining us, Dr. Litt, an associate professor at the Department of Population and Community Health, and her mentee, a PhD student, Allison Cross. Welcome, Allison and Dr. Litt.
Thank you so much for having us.
Thank you for having us.
All right. Could you introduce yourselves, please? Dr. Litt, let's start with you.
Hi. So I have been faculty in the School of Public Health since about 2018. I am trained as a social psychologist, and I primarily study like adolescents and some of the like behaviors that they like engage in, such as like alcohol use, cannabis use, and social media use.
What are you, Allison? Can you introduce yourself, please?
Yeah, I'm Allison. I'm from Ithaca, New York. I have my undergraduate from the University of Alabama in addiction recovery. And then my master's was also at Alabama in human development and family studies. But then I moved forward, obviously, to come here to UNT-HSC for the School of Public Health. And my research really just focuses along similar lines: adolescent and young adult substance use, protective behaviors that influence that use behavior, as well as the stigmatization around substance use and substance use disorders.
That's really interesting. All right. Before I move on to our icebreaker questions, I'm actually really curious about what got you both involved in this, subject or this part of, say, adolescent and alcohol misuse.
I think for me, so when I was in school, I studied a lot of theories. So like really wanting to like understand like the why. Mm-hmm. When you look specifically at like adolescents, there's a lot of things that you're like, why are they still like engaging in that when it's not like good for them, like it doesn't make sense, and so forth. And so from there, I just like really wanted to like understand like why they were continuing to like engage in these things. And one of the things that really stood out to me, and this was back in 2008, was that social media was really like on the rise, and we didn't know like very like much about it, other than they were being like exposed to like a lot of things online. And so I really started to look at social like media in particular as like one way that for like adolescents that they're really like learning about like what their like friends are doing, like their peers, and that it's really kind of a like new form of social influence.
What about you, Allison?
Yeah, so I have a very interesting build into this field. I actually started undergrad as a marine biology double major in chem as well, but that was not my cup of tea, and I decided to look in the human development department of what other majors were there and the different opportunities. And I had the opportunity to meet with the addiction recovery department individual, and she just discussed about current research that was happening, the gaps that are in the field, and the lack of understanding and the misconceptions surrounding substance and substance use disorders. And I took my first addiction recovery class, and I absolutely became obsessed with understanding, like Dr. Litt talking about the why. Like, why is this happening? Why are people still engaging in this behavior? Why is the adolescent and young adult sample and population having such specific behaviors that some people can move forward and age out of the process, mm-hmm. where others don't, and looking at what may be causing that or predicting those changes. And yeah, that pretty much what got me into it. I just wanted to figure out why and what was happening, and I just continued to grow in that realm.
That's really interesting about what actually pulls you into the kind of study that you want to learn from, right, in the future. Okay, so moving on to our icebreaker questions. Let's start with Allison this time. Allison, what is your word for the day?
I think my word for today is finals related and perseverance, because I'm going to persevere through this semester and get it through and be happy when it's done. Just going to make it through my classes.
Totally understand that. Final 2 weeks. And they're just, I'm like, when will it get done? What about your intention for the day?
My intention for the day, I think, is to be positive around with everything, because within finals time and just as a student, it can be extremely overwhelming because there's always going to be something else you have to do. You either have an exam, you have homework, you have a paper to write, something going on, or you want to get involved somewhere else. So making sure that you're still celebrating your little wins as you're going through and being positive about those. So I just submitted a final paper and I'm like, okay, that's a win. That's positive for today. And I want to focus on that and not think about everything else that's going on.
We love that. And lastly, one self-care item for the day.
Ooh, okay. This is my self-care. It's not good self-care. I buy books, and when I buy books, it makes me really happy. So my self-care is to look at my bookshelf and look at all the books that I have to read and build my plan for when I do have free time, which ones I'm going to read first, and focus on that.
Love that.
I know.
Same.
True. Okay, Dr. Litt, what about you? What is your word for the day?
So I think mine is actually pretty similar, and I was thinking of the word resilience. I think that a lot of times things don't really come easily to us. We struggle, and I think really the ability to I guess it's kind of related to perseverance and being positive, but really the ability to say this is not everything, like this is not the end, and to be able to kind of bounce back.
What's interesting is one of the PhD students said that was her word for the day too.
Oh, interesting.
Yeah, it's resilience, because, hey, PhD is not easy. And she was talking about one of her experiments. It's just to bounce back from that failure is what she was hoping for that day. And I'm like, that
very
kind of
important in
resonates.
science.
Yeah, I was going to say, both your words kind of match up with your, with your survey, your designs and what you're trying to research. And so I do think that's really interesting.
It integrates in every single thought.
Yeah. Okay, what about your intention for the day?
I think it's for the day, but I also think more generally, I just want to be kind. I think that whenever we can be a little bit more compassionate, we can give a little bit more grace. I just think that especially with finals and stress, and you really never know what someone is going through, and so I think that if we can really just all be a little bit more kind, that would go a long way.
Retweet.
Retweet that. All right, lastly, one self-care item for the day.
Well, it's really nice out today, so I'm probably going to take my dog out by the Trinity this afternoon, just because she enjoys it, I enjoy it. The sun is shining, so.
The Trinity is really a beautiful place to just go for walks.
It is.
Okay. These are excellent self-care practices, both of you. I think I'm going to follow that one too, because I like collecting books as well. Once I graduate, I'm going to go back into that practice.
Yes.
Hey.
Well, so what I always say with books, there's two hobbies, reading books and collecting books. And I have both, so they complement each other. So there's no harm in just collecting those books. So that's its own hobby.
Yeah, and reading is never a bad thing, right? Reading is always, it's knowledge.
Exactly.
Okay. Now, diving into our discussion, Dr. Litt, can you discuss the coping mechanisms that students typically resort to when they're facing stress or drawing from your expertise in alcohol and substance use research?
Yeah, I think I'll talk about substance use in a second, but I think I really do want to start just by saying that there are lots of students who are actually who are actually engaging in very, very like healthy like methods for coping. And so some people like to read, some people like to go outside. I think a lot of times students will turn to their like friends and like family for support. Sometimes, turn to like exercise, like or yoga, like meditation. And so I kind of want to like normalize that likely like most students are actually like engaging in things that are healthier. Because I think sometimes there's a like misperception that they aren't. And that's not to say that there are not like some students who are turning to, either to like alcohol, like cannabis, like or vaping, but they probably are, well, I shouldn't say probably, the like research would support that is actually like not as common as like others think. But for those that like are turning to that, if we think about the idea of like self-medication, that if we're feeling like stressed and overwhelmed, people believe, that if they consume these like substances that they'll like, okay, well, I'll feel like less stressed. I'll feel better. And while that like might be true in the short term, unfortunately, in the longer term, it can actually show the opposite effect.
So when you say, like, I understand when you say a lot of students, they resort to like healthy mechanisms to cope with stress, right? But for those who do use or turn towards not the healthy options, like say substance use or alcohol use, do you think it's because of a lot of other situations that happen at the same time? Not just like you being a student, but like other things that happen at the same time as well? Maybe family or maybe friends or just social drinking and social use just in general to be accepted into, say, a friend circle or just to be accepted by people around you. Right?
Well, yeah. I mean, I would say for like young adults and like many of our like students here are, using substances like really normally is a very like social event. And I spoke about how some people will turn to social support like when they're stressed. But if that social support is supportive of going out like and drinking, then you're probably more likely then to join in. And, I think that whether like or not it's for like social reasons or coping, like reasons, it's really not about that like it's all bad. It's really about the extent to like which you are like using like the substances, what sort of consequences you're experiencing. And so I think that's the other thing to really like highlight is that when we're speaking today, we're not really trying to say like it's all bad and you shouldn't drink and you shouldn't do these things, but it's really trying to think about the extent to like which it's like impacting like your life, like those around you. And if you feel like it's starting to get in the like way of things, then that's when you should seek some help or try to find some of the other coping strategies maybe that are like little like less harmful.
So for, say, students or adolescents in general, who do you resort to using, say, alcohol or, substance use from your research findings? What advice would you offer to universities and students to encourage like responsible drinking behaviors and still acknowledging the social aspect of, say, just university life?
Yeah, I'll start and then I will pass it over. But, I think for universities, I think that the sorts of things that you're all doing of just kind of starting like the dialogue, like that's a step. I also think, and there's been like research to show that when schools like when they like offer like activities that do not involve alcohol, that students actually like find them like enjoyable, and that they are then less likely to go out like and drink because there's like something on campuses. You tend to see this more on kind of the comprehensive like 4-year schools, where they do like substance-free activities like in game nights. But it really is a very like effective like way for schools to provide a social like environment where where, like, first of all, they're, like, less likely to consume alcohol, but they're also, like, more likely then to find, like, other students who, like, want to do, like, similar things. Because I think a lot of times for students, they think that, like, the only way to, like, make friends and to, like, have fun is to, like, engage in substance use. And so when schools can really provide these opportunities for socialization, it's really, really, like, supportive. For students, I would say learning like limits and like moderation. And then I'm going to pass it over to Allison because I think she can talk about some of the protective behaviors that they can engage in.
Yeah. Just first off, everything that Dr. Litt said, I fully agree. I think having these open discussions and the normalization that you are really stressed, there are things that are happening in your life, and everybody's trying to find something to mitigate that and make you feel better. I also think having the discussions of what positive things people are doing to share how they're coping and sharing that with other individuals, so somebody could think, oh, I really like that idea. I have never thought of that. That's not something I've ever done. Maybe I want to give it a try and see if I would enjoy that. And just showing that there are those other options. In the realm of protective factors, that's kind of been my focal point at this point. Been looking at protective behavioral strategies as it relates to alcohol use. And there are a very large variety. The actual PBS, protective behavioral strategy measure, includes, I think it's 20, ranging from limiting, stopping type, where you set a limit of how many drinks you're going to consume a night, or manner of drinking. That includes putting ice in your drink, or drinking water in between, or not chugging and only taking small sips each time. And then there's a serious harm reduction portion, and that's having a designated driver, making sure you're always going home with a friend, that buddy system aspect. So there's many different ways that people can implement these in their life. With that, I do think some are more difficult than others, and context matters when it comes to being able to actually implement these protective behaviors, because it's not always easy. Say you get invited to a pregame, and one of the protective behavioral strategies is to not pregame. Well, you got invited to a pregame, you want to meet friends, you want to get to know people, you want to load off after a day. You don't want to say no and then just sit by yourself and then be even more stressed. So being able to adapt in those scenarios and implement other strategies. So I am at a pregame, but I'm going to drink water in the beginning, so when I actually go out afterwards, I'm not going out already intoxicated. Or making sure I have a designated driver if I do decide to drink at that pregame, to make sure I'm not driving to that next location, or things along those lines. So there's a lot of different factors that people can implement in their life, and it doesn't have to be a giant thing of, I cannot drink, I cannot pregame, I cannot engage in drinking games, but how you can moderate that and change the behavior within it and adjust it so you can decrease the harms that can be associated.
Harm reduction, right?
Yeah.
That's something that we speak about like a lot. And I think it's really specifically true for substance use. And, especially for like young adults where it is something that is developmentally like appropriate, I would say. The sorts of like messages that we like really try to send out again, like, it's not that like it's all bad and like you should avoid it, but that it's like, okay, if you choose to like engage, these are the things, like some of which like Allison spoke about, that you can do to try to really like reduce the likelihood of consequences.
Yeah, a lot of our resources that I've done in the last 6 months reflect what you guys just said.
Good.
So thank you for confirming.
You're on the right track. That's great.
But so about 2/3 of HSC students drink and partake. And that's according to our 2022 NCHA data. So that could change because we're retesting in the fall. And only about less than 10% of those students who do choose to drink or partake in it, like within that last month, only less than 10 experience like negative effects like brownout, blackout, driving while intoxicated, those kinds of consequences. And so a lot of our students, like I said, like they're knowledgeable. They're adults. They're over most of them are over the age of, 18 to 22. So they have gone through, the substance use training. They've gone through those, undergraduate level programs and whatnot. But it's going back to what are those protective factors? Like if you're going to partake, we know you're going to. What can we do to help you? How can we be here to assist you? But our they do want those protective factors, and they do want to know what they are, which I think is really, really awesome. And I think that's a testament to all the research that's out there.
Yeah, because, I would say, I wouldn't say that, like, no one, but I'd say, like, the vast, like, majority of students, they actually do not, like, want to experience, like, the bad things from drinking. But they want to experience maybe, like, the, like, things that are, like, more fun and all that. And so that's where really knowing, like, your limit, like, that's, like, super, like, important. Because once you get above about a point, like, 0.6, the things that feel really, like fun, like, and good, those start to go away. And the things that start to feel, like, not so good, those go up. And so there really is, like, a way to consume, like, alcohol that will really kind of keep you at that more, like, fun, like, more like a buzz, before you kind of start to go to the side where things become, like, less fun.
What's really interesting is the fact that this is on this campus for the first time that I have seen people, like, openly talk about drinking responsibly. Because back where I come from, drinking is more like as soon as you turn 18, everyone wants to experiment.
Yeah.
And also the fact that there's a stigma around it. Like with parents, they don't really talk about it. And teenagers and adolescents, they just want to experiment. So they go behind the parents' backs, and then that does not result in, like, good consequences. So that's really interesting because I have seen colleagues from back home who would go out partying and not, like, have those protective factors, like you said. Like, if you're drinking, that's okay, but make sure that you drink water in between your drinks, or just put ice in that drink and things like that. So I've witnessed them go just all blackout drunk, which was, it's hard for someone who's just 18 trying to handle someone else who is blackout drunk. That's hard. That comes from experience of, like, I do not know how to take one person who's dead weight and then handle that. But also over the time, I've seen that friends kind of become responsible at that point. They pay attention to how much you're drinking, and they tell you to stop, or they tell you to, eat in the middle. I think that also is probably a protective factor, to eat while you're drinking, so you don't drink empty stomach and it doesn't affect you that much, right? It's really, like you said, interesting to see from this point of view as well, because from what I have seen, nobody talks about it. And now we've, like, open dialogue where everyone addresses it. It's like I've seen, like, the flip sides of two coins, and, like, it's really, really great to just see the part that drink, it's okay. No one says no, but in moderation and responsibly.
Well, I think you touch on a very good point about community behaviors. A lot. I remember, like, telling, my younger brother when he was going and sneaking out in high school and being like, if somebody seems blackout drunk, or if they seem like they have alcohol poisoning, one, here are the symptoms. But also, like, you cannot get in trouble for calling the police.
It's the Good Samaritan laws.
Yeah, I was like, you cannot get in trouble. I need you to, and he's sitting there and he's like, oh my, like, you're not my mom. And I'm like, it's important to me that you know this and that you feel comfortable enough to do that. And so when you talk about protective factors, you talk about those community standards, what advice do you have for students who might feel a little bit unsure of when to step in and say something or do something?
I think that in some of the studies that I've done on college campuses, I'd say, like first of all, the students they don't, like, know about the Good Samaritan laws. And so that's actually something that we keep on the STAR lab, which is our, like, research lab. So, like, we keep that there because if you don't, like, know about it, then you can't, like, enact it. I think that there's sometimes a lot of fear about, like, my friend will be, like, mad at me, like, they're not going to, like they'll think, like, I'm lame. And while that, like, might be true, like, then and there, you also, like, need to remember that they are very intoxicated at that time. And so I would say, like, more likely than not, like, the next day, like, a few days after, like, a week after, like most likely they will see that like you were there to look out for them. And I think that if you really like frame it of like, would you like want someone to do this like for you? So if you were drunk and like you couldn't get home or I was like worried that like you were really sick, like I would want my friends to look out for me. And so there's really no like reason to expect that like your friends like would not like feel the same. But I think you do need to be prepared that like in the moment when like emotions like are high, when people like when they've been drinking, it's probably in like the moment not going to be like easy, but it's kind of thinking about the like longer term that's important.
I would love to also jump in on that as well. I've been working on this one paper where we're looking at the bystander approach and how that impacts the identification of problematic drinking in college students. And what we did, we included a bunch of different vignettes of somebody blacking out, somebody drinking to cope, severe like consequences occurring in that realm. And participants had the opportunity to say, I would not want to intervene. I don't think this is problematic. I think you may need to intervene here. This person definitely needs someone to intervene, and if they would be willing to do that. And it was really interesting to see because we were looking at those perceptions and then the education and the knowledge behind those individuals. If you're more knowledgeable in understanding the symptomology, being able to identify, knowing the laws around that, are you more likely to intervene? And it was shown that, yes, that is the fact. So being able to share that information, but also I think the normalization of it as well. If these college students, they see somebody getting so drunk at night that they can't make class in the next day, like, oh, they're a college student, that's fine. But studies have also shown if those college students see somebody that's 34, gets too drunk and misses work the next day, that's a sign of problem behavior. So being able to show that reflection within their own community, within their own context, and the protective behaviors that they can implement to decrease that, as well as the protective behaviors that they can do to intervene for other people that may be struggling, and the safety measures that they have for themselves to protect them and their friends. And even if it's somebody that they don't know, like making sure like people would be comfortable to intervene if you see somebody sitting at a bar stool by themselves that you don't think is okay, feeling comfortable to go up to that person and be like, hey, want to check in? Are you okay? Do you need me to call you an Uber? Something along those lines. Do you have a friend that could potentially come and get you? And just that comfortability to be able to do that and know the resources to be able to do that.
So you bring up an interesting point where you say people don't really know the laws around it, so they don't know if they should intervene or not. But the fact that, yes, we do have laws that are in place and you will not be in trouble if you help someone else is just something that I think all of us should know about. Because honestly, before you brought this up, I did not know there were laws around it. So I'm like, ooh, I'm going to look it up once this episode is done. Allison, based on your research, what type of collaborations would you like to see, to promote mental health and well-being among students, but also balancing them engaging in these behaviors?
I think there are countless collaborations that are necessary because, as we know and how we've been talking about, is alcohol use and substance use is not single-faceted. It's extremely multifaceted. There are so many different components influencing reasons. So for the mental health aspect, making sure that the mental health counselors also are equipped to handle substance use. Because I think there are sometimes disconnects in that realm where it's like, oh, that's not my expertise. I don't really know how to handle that. So having those collaborations where if somebody is showing signs or requesting help for substance use, they have somewhere to go and somewhere to refer them to. I think it's also important to have community collaborations. I know Dr. Litt and I've had the opportunity to start collaborating as well with the Coalition Challenge. They do amazing work across a lot of different places, a lot of different universities and schools for substance use. And having those connections as a school to other organizations that are in the community, hands-on, knowing what's happening, I think is also really important. And I think one of the biggest things that I would love to see is schools also making it a focal point to share those resources. Because I feel like departments and sections are really passionate about it and they're really happy to share, but you don't see it posted on like the school's main social media page all the time. I think back to my previous school, that wasn't something that I saw on social media very often. But I also did follow like the counseling center, and they love to share resources, which I think is amazing. So making it more of a university-wide collaboration rather than just focusing on like, oh, that's just their section. I don't really understand it, so I'm not going to step my toes into it, but really opening it up to everybody.
Yeah.
Like, one of the things that I would really love to see is that there are so many like experts here. And I think that, and I mean, really it's the case, I think generally, I think a lot of times the decisions and the communication is not necessarily coming from people with specific
Credentials.
Yeah, the credentials. And I mean, I understand why. We all have like so much going on. There's a lot of like moving pieces, but I think at the like same time, you know, that I mean, I am not a social media like expert. But I know like the science. And so then if I can like work with someone that can really craft a like really strong like campaign, that is like fantastic. And the other thing, because I think that Allison covered it like really, really like well, but I would say for all of our clinicians that we are training here, and I think that some of them get the training, but I'm honestly not entirely sure. But it would be fantastic if they were all really trained to do some sort of like expert, which is the like screening, brief intervention, referral to treatment. And so, you know, if you are learning to, like, let's say, give a general like exam or like physical, like make sure that there are a few like substance use like screening items in there. And I think that a lot of physicians and ones that I've spoken to, they're like, yeah, we like learned about like substance use in like one like module, but we don't really feel comfortable speaking about it. And so I think that if that was a sort of training that like everyone got, and there were continuing like education about it, I think that would be a like really fantastic like way for like our school as well, just to make sure that like the next like generation like is going out there with the skills like and knowledge.
Oh, I love that. I know last fall, they created like the opiate recovery team because they realized all of us have such siloed projects when it comes to recovery. And so that was something I really admired the HSC. I think it came out of Marcom. It was somebody.
I think it did too.
Yeah, who like started messaging everybody, and they're like, "Hey, noticed you have this event. Hey, noticed you have this event." He's like, "What if we just combined it?" And we're all like, "Okay,
right? Yeah.
Tell me when and where." And so that is something I think we're slowly getting better at. But again, it's a campaign, and it's a campus campaign. We can't have like all these different divisions or offices that students aren't really paying attention to unless you've got a specific focal point or an interest in it. And so that is something I'm excited to see us improve on.
I am too, but when Dr. Litt talked about physicians not being open to talking about it, reminded me of the conversations I had with a family friend who is a physician, and how they did have a homeless man who was drunk. That was the exact words he told me. He's like, it was just one of the modules that I learned, so I didn't know what kind of questions to ask, or how to screen that person, and then move on to like what kind of treatment they should refer him to. So it was just really interesting because like that's all it was. It was just one theory that one class that we had attended, that we studied, and that was it. There was no practical, like how do I go about it? Maybe a simulation or something like that. And
that's actually interesting. If we could like work with the simulation center to do something like that, and I mean they're amazing, so I'm sure they could make it happen. But yeah.
Yeah.
Or a good like IPE.
Yeah.
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 Like, just and these activities are actually pretty fun too.
Mm-hmm.
So it's not like it's just purely educational, but you can also make that like a good practical, just not theory. And the our simulation center is really
Yes,
good.
yeah, yes.
Like we tried one of the epi outbreak simulations in there, and we're like, ooh, that was like real world experience right there. It was great.
Yeah.
But yeah, it's just really interesting to see how sometimes it's just theory and you don't know how to apply it once you're out in the out doing your big girl or big boy jobs outside.
Yeah. Well, I think you kind of touched on it very slightly at the very beginning of our conversation, and then just now it reminded me, but comorbidities are such a huge thing, especially in substance use. You know, you talk about how many people who are homeless and who also have, you know, they do turn to coping in these different unhealthy lifestyles and whatnot. And I'm a huge proponent of housing first models.
Yay! Yep. We just learned about those in class last week.
I can talk about those for hours. But I think a lot of times when we look at comorbidities, or we look at, you know, the 36-year-old versus the college student and how we expect other people to handle things, it doesn't reflect our best characters as society. But also I don't think we're equipped. Like the general population is not equipped to be able to like work with that and talk about it and deal with it.
They're not equipped, but there's also so much like stigma.
Yeah, that too.
Stigma for substance use, stigma for like mental health, and then when you combine the two, and I think a lot of people, they don't really know like the language, they don't want to like overstep, and so I think that's something that we speak about like a lot is like what are like the ways that we can try to really really combat like some of that stigma, because I also think that's a lot of the reason that sometimes people like that they like don't get involved. Because they see someone as being like less than, or you know, see someone as not like worthy of help. And I'm not saying that's for everyone, you know, but I think that's a like unfortunate truth. And unfortunately, some of that same stigma like will stop people from seeking help. And so that's something, like I said, that we speak a lot about, and I know that like Allison like has studied about how like really like one of the things that like we could do as a campus is to really try to like normalize that there are students with various like mental like health concerns. There are like students who are going to struggle with substance use, and that they are still people. They are still like really part of our community, and that it's really on like all of us to support them.
And now that you bring that up, you know, my health communications class, we have this project where we're creating a brief, and my topic was stigma around physicians or healthcare workers reaching out for help for their mental health. And when I was doing my research, I saw that statistics does show that they have a high number of physicians who use like over-the-counter pills for coping mechanisms. And that I found that really interesting because I'm like, you don't really think of it that way because you're a physician. You know the harms of using it, but you still use it to cope with the long hours, the stress, the anxiety. And that really kind of hit a nerve because that was, I'm like, I didn't know people do that.
Well, and I think that, you know, that because of the stigma, a lot of people think that it's only a certain like type of individual. And really what like we've known for years is that it's really like everyone, like it's all ages, it's all like races, like ethnicities, genders, jobs, and that it really is something that really will like affect us all, even if it's like not like ourselves, like someone that like, you know, someone in your family. And so like really starting to speak about it and to like learn about it, I think is going to be very like useful, both just so that you're more like educated, but that also so that you can be like more supportive, like if and when someone comes to you for help.
And I know we touched upon this a little bit, like going into a little more detail, in your opinion, what kind of interventions or like preventive measures have shown the most promise in like tackling these issues of substance use in, say, students?
Yeah. So, I mean, there's been a wealth of like research showing, I mean, I will say there are like lots of like strategies. There are the campus like wide initiatives, there are policies and things like that. But really what the research is starting to show is that if we can really personalize the information to the like individual, that is like more effective. For example, if we think about like norms. So like a lot of times we will do a like norms campaign where it just says, I think your stat was like, what percentage?
2/3 of HSE students choose not to drink.
Right. Yeah. So you can say 2/3 choose like not to drink. And it's on like a poster. There's a logo. It looks great. Those have been shown to be like somewhat effective. But what it like really like requires is some sort of like mental gymnastics, if you will, for someone to say, what did I think they did? Like, what do I do? And it kind of like requires them to like make like several comparisons. And frankly, they just even need to like see like the poster or the thing. And students are very like busy, like with finals and things, like they're not looking up, they're looking at their phones. And so where a lot of the science like has gone is to doing things that are like online and short and personalized. And so a lot of the work and the idea is a personalized feedback intervention is that it will still talk about things like norms and like attitudes, like, beliefs and cost of alcohol, and there's like a range, but it actually will like use students' like own responses to say, for example, like you drink like 4 days a week. You think the average student drinks like 4 days a week, but actually the average like HSC student drinks like 1 day a week. And then that can really cause a lot of like, like that's interesting. I didn't like realize that I drank like more than the other students, or I didn't like. Or like I thought the students like drink a lot, but they actually don't. And so in that way, you're really pointing out certain discrepancies. And so instead of just like looking at a poster, it's also then really directly connecting to themselves. And people like really like want to like know, what do I look like in comparison, to like other students? So, same thing. The average like HSC student spends, I'm just gonna like make up a number, spends like $100 like a month on alcohol. And it says like, you reported that like you spend like $300 a month. That's a discrepancy again, where someone could say, I didn't realize I spent like more than the other students. And so these sorts of like interventions were like originally developed to be done in person, like one-on-one with a facilitator, and they're very, very like effective. But as we know, students are swamped. And to try to get a student to show up in person for a like face-to-face like session, particularly I would say since COVID, has gotten increasingly more difficult. And so the like nice things about these like online interventions is that they're like very short. You can do it on your phone. You don't need to actually like see someone and speak to someone. And it's been shown that these like very short, like 30 minutes or like less like self-guided interventions, they've actually been shown to reduce a like range of outcomes. So the amount that they drink typically, the amount that they drink like on average, the like most amount that they drink, like the number of consequences and so on. And so these are in some ways similar probably to some of the things that a lot of like first year college students take, kind of the like mandatory trainings, but they are shorter. And they're less like educational in a sense. They really are like more about trying to develop certain discrepancies that like we know from like years of science should lead to like a reduction in behavior.
I love how you mentioned that, tailoring that intervention is going to bring about better responses and outcomes, right? And also the fact that once I know where I stand compared to other people, I'm more likely to change my behavior. If I know that what I am doing is not that great compared to my friend, I'm more likely to change that behavior and be like, okay, I think I have a problem and I need help.
Well, and I mean, like I said at the start, I am a social psychologist, and like one of the things that we learned probably on like day like one is that there is a like fundamental like need for people to compare.
That's true.
And whether like we like it or not, whether it is positive or not, it's there. But I think the idea of these like tailored like interventions and the idea of developing the discrepancies is that you're kind of like forcing the comparisons. And people are very like motivated, but they're also very like interested because we can develop like something that is like fabulous, like, and it works. But if students are like bored by it or they don't want to do it, it's like not going to be effective. And so we need to find some sort of like a hook for students. And I mean, for like most students, that like hook is like learning like about themselves and then the ability to say like, where do I fit in with everyone else?
I love that we all by default like to compare because that is so true.
Various levels of it, right? But it's there.
All right, Allison, as someone who works like closely with Dr. Litt, can you share some insights from your research or experiences regarding the challenges that are faced by college students in navigating these social pressures and norms around, like, substance use?
Yeah, I think from what I have researched and what I've read, I mean, there's so much in that realm, and it can vary in many, many different directions. But some of the challenges, I think, kind of what we were just talking about, is being able to recognize those differences in order to compare and having the ability to know that that's not the norm per se. And I think also a major challenge that can occur is if you're in a context where it is so extremely normalized that you are drinking 7 drinks a night and you do that 5 nights out of the week, that's normal. All your friends are doing that. It's really difficult to get out of that behavior because those are your friends. That's your peer group, especially when you're looking at college students. That's a huge focal point. Think sports games, events, concerts, all of that has a very heavy substance piece to it. And I think if that's your environment, it's really hard to separate yourself from that and grow while also keeping those connections if you want to keep those connections. So I think with that, realizing that that's not the norm, not everybody is experiencing that, and also how to implement all the way back what we were talking about, those protective behaviors where, okay, this is your friend group, this is what everybody is doing, you still want to go out with them and experience that and have that social aspect. What are the protective factors that you can implement, and which ones are easier to implement? Because like we talked about, they're not always easy. They are conscious decisions that people have to do. So what we can do as researchers is make it as easy as possible and share information and tips and tricks to make that transition as simple and fluid as they can.
I love that. Do we have any resources on campus that students can use in cases of where they feel that they do need help reaching out?
You all turn to me and I'm like,
You're the student service specialist.
Yeah, I mean, there's, of course, care team. They can, the great thing about care team is that they will connect you with the right resources. So they will listen to you, they will hear your situation, and they'll kind of, not give you advice, but they're going to help kind of lay that foundation. Be like, here are your choices. Here's, what works best for what. Fort Worth, it's a big city with a lot of resources, a lot of partners. I can only see in acronyms right now.
Yeah, I was going to say, if you go to the Star Lab website, there is actually a link that lists resources in Fort Worth, across Texas, and nationally.
Yeah, and I know our website, the OCC website under Student Resources, has recovery resources, but there's new information coming out every day regarding what those behaviors are, and then it just depends on what your preference is. Because I know, SAMHSA has an alcohol screening on their website, and it's how comfortable are you going to be doing that, and how open are you going to be doing that without somebody looking over your shoulder, kind of being like, well, no, you did drink yesterday, you need to mark that. And so it's just that personal accountability. How do you want that to be reflected in your resources that you're going for? You can make it as anonymous as you need it to be. That's one of the great things about the digital age.
Yeah.
So you don't actually have to.
There's hotlines, there's other things you can use.
There's so many things. You can chat on the phone with somebody. You can actually call and talk. Or you can just go into a walk-in clinic.
Coming back to the point that Dr. Litt said, when those interventions are online, I love the ease of access. It's at the tip of your fingertips on your phone.
Yeah.
But yeah, it's just as easy to just send a text or maybe just dial a number and call the hotline.
Well,
there's almost always anonymous.
Yeah, there's screenings for everything. Mental health, there's screenings for vaping. If you're having issues with that, and not just, am I addicted to this, but how do I quit? What's my best step? A lot of those websites now that I love about them is that they are making those personalized quit plans for all these different substances. And it's very personalized, and they walk you through, like, you know, you seem like you're more irritable without this. Here's some tools, here's some tricks to navigating those feelings.
And it's relevant to you then. So then, like, you're more likely, you know, to say, oh, yeah, like, that like, is what I said.
Yeah.
And I do want to, like, you know, I, like, do want to find a solution for this. And so that's really the, like, magic of, like, things that are more tailored is that, you know, if you are really part of the solution and that you feel like, you know, there's, like, investment in it, you're probably, like, more likely to then, like, follow through with a plan.
Yeah, and I'll have those links in the comments.
Yeah, we'll have those links in the description. And so before we wrap this episode up, is there any final advice or like any words you would like to...
Words of encouragement
for our listeners out there?
I mean, I think, you know, we are going into finals weeks. And so going back to, like, what we, like, started with, I think it's really important that people, like, find, like, ways to cope with the stress that are going to be productive. And so if you, like, know that, like, finals week is going to be very, like, stressful, schedule something, like, on your calendar. Like, I'm going to go on a walk. I'm going to go to a, like, yoga class. Or I'm going to, like, I don't know, call my friends, like, you know, like, and talk to them. And so, because I think so often we get so swamped that, like, we actually forget to take care of ourselves. And so I would say, like, find the time. And if you choose to use alcohol to celebrate, like, finals are done, or to cope with the fact that you're still, like, in finals, then, you know, that is your choice. But there are things that you can do to, like, really, like, reduce the harm. And so I know that, like, Allison spoke about, like, some of them, but if you just go online and you search for protective behavioral strategies for alcohol, you're going to find, like, so much stuff and, like, the tips and the tricks. And it's probably a good idea to, like, really, like, look at those and to plan ahead and think, like, what are the things that I can do, like, when I, like, find myself, let's say that, like, I drink too much, like, I'm out. That's not probably the, like, best time to be coming up with a plan. And so if you are going to be drinking, really think about, like, what are the things that you want to do beforehand. So, like, what's your limit? Is there, like, a friend that you can say, hey, like, I only want to drink, like, 3 drinks. Like, if I drink more, stop me. Like, make sure that there's, like, a designated, like, driver, or that you have, like, Lyft or, like, Uber, like, already, like, installed on your phone, and, like, your card's connected, you know, like, all those things. Those are things to do before you drink, just so that we can, like, ensure that that you are, like, less likely to experience consequences.
What about you, Allison? Any
Yeah.
words of encouragement?
I would say the first thing that comes to my mind is that whatever you're experiencing and whatever you're feeling, whether it's stress-related, school-related, substance-related, you're not the first one to experience that. And you're not the only person experiencing that. And there is something out there designed to help you. And you're not just without any resources or without any options. Like, sometimes it's really hard as a student, and just in general, like, I am so stressed, I'm so overwhelmed. I am the only person that's failing, and I can't stay afloat here. No. Almost every single student has felt that at one point in their life in some way, shape, or form. Every single person. The imposter syndrome
Faculty feel that
real.
too sometimes.
It never goes away. That imposter syndrome never goes away. So just reiterating to yourself that you're not alone, and then if you do want to use a substance, like Dr. Litt was saying, making sure that you are planning ahead and including those protective behaviors in your daily life. And I think one of the most beneficial things that you could potentially do is just being intentional about those behaviors. And like we were talking about, planning ahead and having those ingrained in your mind and in your behavior. So we were talking, I think, earlier before we started about, like, muscle memory. It's muscle memory to be like, okay, I just finished my drink. I'm going to go grab some water. Something like that. So it is possible if you're interested.
All right. This has been an incredibly insightful discussion. I love seeing both aspects of also like a researcher and the mentee who works so closely with Dr. Litt. I love that. I hope our listeners have gained valuable insights and encouragement to prioritize their well-being throughout their university experience. Unfortunately, we're nearing the end of an insightful season of Wellbeing Unlocked. We hope to see you next season. Until then, take care and stay connected.